All the elements or satisfied requirements are in and set for government's latest vaccine deployment for the elderly, immunocompromised and healthcare workers, which formally kicks off in less than 48 hours at PTV's Melalis Moras details in this report.
The government is aiming to start the inoculation of the fourth dose of COVID-19 vaccine or the second booster shot for senior citizens, healthcare workers, and immunocompromised individuals on Wednesday, April 20 in Metro Manila. In an interview today with PTV, National Vaccination Operations Center or NVOC Chair and Health Undersecretary Mirna Cabutahe said there are 3 requirements to officially start the new rollout, and this include the release of new emergency use authorization by the Food and Drug Administration, which was already done by the agency last week. Second, the presentation of recommendations of the Health Technology Assessment Council or HTAC, which is now being finalized. And third, the release of actual vaccination guidelines by the NVOC.
Meron na tayong draft guidelines ng NVOC. Ang hinihintay na lang natin, ano ang pwede nating idagdag pa o alisin o ayusin para nakaayon sa FDA, EUA at saka dito sa HTAC. We were initially looking at April 20 sana, pag-umpisa sa NCR, parang phase rollout. Pero kung hindi makakaabot, titingnan na lang natin. But as soon as possible, we will be able to issue the guidelines and then roll out una sa NCR.
At the Laging Handa program, World Health Organization representative to the Philippines, Dr. Rahendra Yadav, highlighted that the Philippines must continue prioritizing the vaccination program against COVID-19. If not, and should the health protocols also be neglected, the projections of COVID-19 surge next month by some experts may come true.
My appeal to all Filipinos, and especially the local chief executives of places where there is a low vaccination coverage, my appeal is to continue with the 3 defenses we have. The first line of defense is to protect us against infection. That we can do through masking and ensuring good ventilation. Second line of defense is vaccination. Unfortunately, as I mentioned, many barangays have not reached the 70% coverage that WHO advises. We have to aim that all barangays have at least 70% vaccination coverage. But reach even beyond 80, 90, 100. And then the third line of defense is to protect against deaths.
In a statement issued by Acting Presidential Spokesperson and Communications Secretary Martin Andanar, he pointed out that prevention is better than cure amid his calls to the public to get their shots for protection. At the same time, he also reminded the Filipinos once again to follow the minimum public health standards. Melalis Moras for the Nation.